Good evening and a very warm welcome to this very special discussion on how schools in India can be reopened safely. As all of you can see, I am not Nidhi Razdan, but Nidhi couldn't be here today. I'm Manika Raikwar and I will be your host this evening. Schools are just so essential, not just in the life of students, but for all of us. Just a few days back, the AIMS director, Dr. Randeep Guleria, said there is a need to work aggressively on strategies so that schools which have been shut for a year because of the COVID pandemic can be reopened. So what are these policies? What are these strategies that we can put forth, that the government can put forth perhaps, to ensure that our children go back to school safely? I have with me Shaheen Mistri, who's the CEO of Teach India, Dr. Mahesh Balsekar, who's a consultant pediatrician, Deepika Sharma, the principal of Grand Columbus School, Shalini Bakliwal, an entrepreneur and a parent, Abhishek Gupta, the CEO of Yuva UNICEF, and Raghavendra Yadav, a student of class 11. So let's begin really with you, Raghavendra. How eager are you to go back to school, and how safe do you feel if you were to go back to school in these current circumstances? Raghavendra, can you hear me? Okay, I don't think he can hear us, and maybe that's a bad internet connection. Shaheen, I'll come to you. Just before this all started, we were speaking about what is needed really to reopen schools. And you said something very interesting. You said, let's not focus on when to reopen schools, but how to reopen schools and the conversations around that. Could you elaborate on that a little?
Yeah, thanks, Manika, and thanks for this chance to continue and build the dialogue. You know, I'm just reeling with all the research that I'm reading on the long-term implications of what's happening to our kids. This morning, I read that the World Bank is now saying in low and middle-income countries, 2/3 of all children will not be able to read a simple paragraph. When you think about the implications of that on their ability to reach their potential, it's an absolute catastrophe. And so this is where I'm approaching it, is saying, while the health is of paramount importance and the safety of our children does and should come first, we cannot skew the balance between health and education. We have to elevate the education discussion now and really be talking about the fact that we need to get kids who today don't have a voice and cannot stand up as an army of 250 million and say, we demand to go back to school. We need to do that work and create that platform for our children. I think it's possible. As we know, 90% of countries around the world have reopened. There are lots of examples to follow. There are detailed guidelines that health experts have put. There's, in fact, I don't know how many of you know this, there's a small village school in Maharashtra that under the village panchayat actually has been open since June. 3 hours a day, small groups of kids sitting outside, social distancing with no problems at all. And so I think it is possible. It is going to be difficult. The most important point, I think, to make in this debate is we need to start preparing. And when you say how, we need to vaccinate teachers and school staff. We need to put safety precautions in place. We need to start alleviating the very real fear that parents are facing. We need to design learning bridge programs so that when children come back, they can catch up. We need to put a social-emotional learning component into education because our kids have been traumatized and faced a lot of mental anxiety. So there's a lot of work ahead, and we need to start that work as of yesterday.
Right. You know, and what you said about health, there is a genuine fear, and I wanted to come to Dr. Balsekar on that despite the vaccinations, despite sort of, you know, a lot of people are talking about creating bio bubbles and all of that, there is a very real fear that once kids are in school, they will transmit faster. You know, there'll be many more infections. Can you speak to our audience about that?
So early in the pandemic, it was believed that the behavior of COVID will be like influenza. And influenza virus spreads within children very quickly, within schools very quickly. And these children go home and infect their adults. So this was the model people feared. But it was almost in May and April last year that they realized that COVID is actually behaving very differently. And the infection spreads very little between children, particularly under the age of 10 years. And they don't spread infection to adults. Similarly, adults don't spread infection to young children. This whole concept really took a turn, but nobody seemed to pay attention to this extremely vital data. Now, Sweden, for example, I'm not saying they managed the pandemic well. Their mortality rate is almost 10 times more than the neighboring Norway. But they believe that the society should be open and schools should be open. But the information from Sweden that during the 4 months of the first major wave, they found that there were no deaths in the children. The chance of a child going into a hospital was 1 in 135,000. And when they saw the teachers who were attending school during the pandemic, the chance of a teacher requiring hospitalization was 20 per 100,000 and no different from any other profession apart from healthcare. So it's well known now that schools are actually very low risk. They reflect the community level of infection, not higher. They are not hotbeds for infection and do not spread. And particularly under the age of 10 years, the chance of spreading infection is extremely low. Now, the problem is that everybody knows that younger children do badly without in-person education, and they really need the social interaction. They are not able to learn online, and their mortality morbidity is extremely low. But academic pressures are high, and therefore in countries like Germany and India, they've started schools for older children who actually behave very much like adults with a much higher infection. So in Scandinavia and USA, they started for the younger kids, but in Germany and now the talk in India is that we'll start for older children. The younger children who are actually going to be spared of most of the consequences, nobody's talking about.
So, are you saying that we should actually sort of start schools for kids who are 10 and younger, and maybe then look at a phased opening for those who are 10 or 12 and older than that?
So theoretically, yes. Practically, it will not happen. Because to develop the infrastructure to look after schools during COVID times, nobody has the confidence and the infrastructure is just not there. And because of academic pressures and parental pressures and government viewpoints, we are going to be starting for the older children, and that is understandable. But theoretically, it's the younger children who need it more, and they are the ones who actually suffer least when schools open.
Uh, uh, Mr. Gupta has actually, asked that can you refer to the studies that you have just spoken about? Can you tell us a little more about these studies that actually show that kids under the age of 12, under the age of 10 are actually not getting infected or spreading infection? So can you tell us a little more about these studies?
So I'll give you several examples. For example, in America, they've had 4 million cases of COVID in children. The number of deaths in children was 297 with a mortality of 0.03%. And 10 to 20 times the number of cases actually take place. So the mortality is probably much, much lower. If you see in India, under the age of 40, the population is under the age of 20, the population is 40%. But the mortality amongst children under the age of 20 is 1.2%. They had a large study which they published in Lancet from 7 countries, 5 European countries, Korea, and USA. And over a 1 year period, through 2 devastating waves, and they found that the total number of deaths in children was 48,000. But the COVID deaths was only 220, which accounted for only 0.5% of the overall pediatric deaths. So you see, COVID is not a very important cause of death in children. The mortality is extremely low. Just see, 48,000 deaths, only 220 due to COVID, which accounted for only 0.48%. And if you split the mortality further and analyze the paper, you find that under 10 years, the percentage is 0.25%. And over the age of 10 years, it is 1.2%. So the mortality over 10 is 5 times as much as the mortality below 10. So you see that each death is tragic for anybody, particularly in children. But if you look at it at the global level and to understand the perspective, children do extremely well with COVID. Mortality is very unusual.
The data, the numbers are fascinating, and I sort of want to ask you so much more, but I will come back to you. I want to go to Deepika Sharma next. Ma'am, tell me, like Dr. Balsekar said, that mostly in India we're speaking about schools reopening for senior students, class 10, class 11, class 12. Uh, will schools manage social distancing? Will they manage, kids wearing masks all day, especially in, this heat in large parts of the country? Do you think it's possible for schools to open under COVID norms?
So good evening to everyone. I'm glad we're talking about this because I think everybody should consider schools as essential services and caution that not opening them will hamper students developmentally and educationally, which has happened. This gap of 15 months is huge. And the age group between 2 to 3 or 4 or 5 has not ever attended a single day of school. And there have been huge dropouts. Okay, now coming to the if we can follow the safety protocols, yes, we can. And I'm based out of Delhi NCR, and it's pretty hot out here. But yes, the more strictly you implement the safety protocols, lesser is the risk of the infection being transmitted. And you would be surprised to know that December, January, and February, I had the age group between 3 to 5 come in the groups of 2 and 3 daily, and there was no, yes, I experimented with the help of, I engaged the parents. They were very happy to send them. The children were very happy. So we experimented, and there was no transmission. In fact, in US, the study shows, like Dr. Balsekar was also saying, that the risk of transmission below 10 years is only 1%. And unfortunately, this information was never really shared, I think, because we did open up for 9 to 12, not just 10 to 10th and 12th, 9, 10th, 11th, 12th for a while between, say, December to March, April. But yes, if you absolutely strictly implement all the safety protocols and the screening is done, the teachers need to be vaccinated, because as of now we don't have vaccination for under 18 or 16 in a country. But if the teachers are vaccinated, the chance of one teacher transmitting to a student is higher than a student doing it to the teacher. Again, that's according to the study. So I feel that if you can call them in small groups. You can call them alternatively. You can have hybrid form regularly. I mean, if my class can take about 30 students, I call about 12. And if they're wearing the mask in correct manner, then we don't need 6 feet physical distance. 3 feet is good enough. The time they eat, the time they want to be out. I mean, if I personally did not have outdoor activities or indoor activities, I just called them for academics for about 4 hours, because of there's so much of apprehension among the parents and the students. They're absolutely terrified. So, but yes, in case we did have few activities, it was in the open area. Okay. And whatever the cafeteria was closed, the gym was closed, and whatever they wanted to eat, they had to carry from home. We had water and other facilities, but we preferred if they would carry the water themselves. But yes, the other resources, like we did have extra masks, we did have sanitizers, we did have closed trash bins. Masks were absolutely, there was screening right at the gate. There was a layered prevention strategies, and they were strictly implemented. There was a staggered arrival and departure. Okay. And if they use a school transport, then we told them to ask them to wear double masks. So wearing the mask, if you're sanitizing, if you're maintaining a physical distance, like one student on one seat in the bus. And we sort of managed to get through, and there was no transmission, believe you me. So I think what we need to do at the moment is spread the information that what is happening to the students when they're not attending school is worse than whatever the studies have just projected and my predecessors on the panel have just said. I think both of them, Shaheen as well as Dr. Balsekar, made a lot of sense. I totally agree with it. So I think it's time we did reopen.
What Dr. Balsekar, the data that he gave, what Shaheen spoke about, what you're speaking about, factually, everything's correct. But here comes in that thing that we call sentiment, that, perhaps, a parent's feelings. And I want to go to Shalini at this point of time. Shalini, as a parent, even if what Dr. Balsekar said, that there were about 200 deaths, I mean, for a parent, that's 200 deaths too many. Where does that apprehension stop? Do you think we can let that fear go by now and say, okay, we're willing to take that step and send the kids back to school?
Okay, from a parent's point of view, can you hear me?
Yes.
Yeah, so I have a daughter in class 12 now, and she spent entire class 11 in a closed room. So, and now class 12 also seems like it's going to be in that same room. They don't see sunshine because school is still, about 1:32 every day. And then they are exhausted and have to finish their work. So they are cooped up in that room. But having said all this, and I really buy the point that, yes, it's hampered them developmentally, socially, of course, studies and everything, but haven't been through the last wave that we have in Delhi. And I went through it very close quarter. I lost a parent. I have another one critically ill at home. I'm also in the medical field, and in the sense of just being able to supply medical needs to people. I'm not a doctor, but I know what it meant to go through that April in Delhi, April and May. And frankly, as a mother, I'm very scared. Aisha, my daughter, had been through COVID. We all went through it last October. She soon after COVID got dengue. Immunity is extremely low. She hasn't been able to really step out, and there's hardly any physical fitness because in our colony we were not even allowed, even now, to walk outside. So I don't know, I mean, it's still debatable. I'm listening to the doctor, I'm listening to the school principal, I'm listening to other parents who say enough is enough, and we need to get our kids out of here. But deep down inside, there is a fear. There is a fear that even if they miss another year of school, is that more important than the life of my child? Yes, I may be very extreme just now, but yes, but I do feel that my one big thing is that, are all teachers vaccinated? What about the staff, the support staff, the others in the school? These are all big schools of Delhi. We're not talking about just having 20 kids in a classroom or anything like that. And yes, we may be prepared, they may be screening them, but children are children. They are going to take off their masks. They are going to hang out with each other. They are not going to flout norms. They don't understand the gravity of the situation as we have. At least from a mother's point of view, I know that. Even now, when I take her just for a drive in the car, I have to tell her, put your mask on. Do not get off without the mask. So yes, I think that education has still to be imbibed by them. And they miss school like hell. I mean, my daughter told me, you're not sitting here and telling them not to open. Please don't say that. And I said, no, I'm not saying that. If we can manage to do it in a phased manner, if we can manage to put the protocols in place, if teachers are vaccinated, and like sir said earlier, that teachers are more at risk, and ma'am also said it, than the children. But I just feel that, children are now, like she's 17, they can also transmit it to each other. And with this whole Delta wave and the variants, one does have that fear, Shaheen. So so that's what I want to say. I may keep changing my viewpoint as the thing changes, as the, how I still feel as a city, I don't think we are that prepared. I mean, I've seen the worst. Yes, today we may have systems in place in that sense, like more oxygen, more hospital beds, more whatever. But when it came, I mean, it was really, really scary. So just that. I just wanted, yeah.
I can totally understand. I have a son who's in class 12, like your daughter. He spent all his class 11 inside a room, and he's desperate to go back to school. But of course, and I also wanted to say, I'm extremely sorry that you lost a parent. I mean, there can be nothing more devastating. And that April, that month was just horrific in Delhi, what a lot of people went through. But Deepika, you wanted to come in and say something when Shalini was talking. Please go ahead, and then I'll go to Raghavendra.
Yeah, so I just wanted to tell Shalini, I definitely agree with that sentiment. But then, the decision to reopen the school should be taken locally. Suppose it is in a containment zone, of course, it's a big no-no. I don't know, anybody would not take a risk. If somebody's health is at risk, suppose your immunity of a daughter is low or anybody else is low, we did not call her because we were having online and offline simultaneously.
Yeah.
Okay, so that's okay. But then not having students totally because the gap, I mean, now here we are talking about health versus health. It's not anymore the future versus health, it's health versus health. Because, I mean, you talk to any of the doctors and anybody who's from medical or any education as well, they would totally say, yes, it needs to be considered at a big time. And academically is one story, but then, yes, for little ones, like I'm saying, there would be loads and loads, maybe in millions, where the students have not even seen the school.
Yeah.
And like both your children, they're in class 12, which is such an important class. And I think they really love, and we all have memories for 11th and 12th. They would have missed out. Like my class 12, they never had got a farewell, so I'm getting so many mails. Can we have a farewell in July if things are okay, So I keep getting that. So they've missed out. It's more than academic,
Yeah. No, I agree on that completely.
No, and so let's go to the young man here, Raghavendra. Why don't you tell us? You're a student of class 11, and I'm sure you sort of must be talking to a lot of your friends. How desperate or how eager are you to go back to school, and how safe do you feel to go back in these circumstances?
Yes. Before starting on, I talking about, I've seen my friends in this. So I want to just start with stories. Stories of my friends. So I had a classmate in 10th grade called Jishan, and Jishan is a guy in 10th grade for me, and he passed out school in 2020, and after that. We come from slum communities in Bombay, so unfortunately for us, if you talk about giving the child one room, we just have one room to live, and we cannot obviously afford a lot of digital devices to continue learning. And not just we, 24% of households in India just have internet access, so you see the divide, that is 76%. And we do understand the safety option, but for children like us, if we are not going to school, we are made to work. And backing this, I was just reading in the morning the Hindu, and I found this organization that had done a survey. So it is called Campaign Against Child Labor. So they did a survey on 880 children from across 24 districts, and they saw that like from the pre-pandemic, the child labor was increased from 28.2% to 78.6%. So, and out of which 96% of the students or the children that were there, all of them were aged from 6 to 18, and all of them said that because of the financial barriers. And we do agree, and we are fairly aware about the rich and poor gap between our most of our population. Around 70% comes into that bracket. They were forced to work, and as being in the slum community, for me as well as like for my family, livelihood was like a big question. Like and education wasn't even foremost priority because schools were closed. So whenever I could ask my parents, like for a friend of mine, like he was asking his parents like whether he should start pursuing for a new online course for digital marketing, and what he got in return was school to bandi hai, kaam hi kar le kuch. So that's the mindset that we are developing with this. And you talked about, Shalini ma'am, I really agree with you, the amount of fear you have for the children we have. I was also reading, how much the impact the COVID-19 is going to have over our higher education. So we currently have around 70 to 80 crore people under the age group of 28, and what this does is that we are going to be producers. The next generation is just going to be producers for creating jobs. And if we and with schools not being opened, we just will not be able to have skilled labor and things to just we cannot be consuming everything, right? So you talked about, children, there is a fear of life, but what if we don't have a life after that? No, this is the big question that I am exploring, and as well as also pointing to that, like 18% of that research that I was talking about, the child labor, they were officially meant to verbal abuse or mental abuse. And as well as, you talk about and backing Doctors Mahesh's point, which was, Pfizer, the vaccine production, they were doing research on vaccination among children. So they brought up some 100 children, and out of which 60 parents withdrew, like they didn't want their children to participate in the vaccination process. But out of the 40 that did, they found that they already had antibodies, fighting the COVID-19 virus. And not just that, it is also backed in Bombay as well, as that 50% of our children are that. And in the same conditions China was in, and China opened schools to 190 million children. Just, and I'm not backing authoritarian rule here, but they went with the one mindset that we need to open schools, and they had this one way, and there was no opposition involved in that. And that is not something right. But you can see, like, if we talk about how, the what and ways, they are automatically going to come up when we just start the conversation. Even if we start the conversation of reopening school now, it will almost take 2-3 months for our government to come up with official things and all. So we do understand there is we have already lost one academic year. Losing one academic year, our children have been promoted to directly grade. I myself, like, have lost. I don't have learned anything in grade 11, I would say. My college classes, my teachers were not equipped to provide me quality learning, I would say, online learning. And this is not just happening. I to have access. Like, think about the students. There is in rural areas. I'm currently now in my village, and I see like around 50% of our households have access to internet itself. I'm not talking about digital devices, access to internet. So if you continue this, and don't find ways to open that, I'll be later talking about how should we do that. But right now we need to consider why this is important, and what are we losing big in the end. And the third wave is being predicted to around have like 1 crore 20 lakh cases, and children being just 10% of that being affected with that. So you either make our children worry with their mental health. The child helpline number 1098, they received around, from May 1 to May 20, they received some around 360,000 calls in 20 days. That's even faster than the COVID cases that are spreading among children. And that is the kind of uncertainty we have developed. We have around 20 to 40 lakh JEE NEET aspirants that are just uncertain about their own future. They don't know when things will start, when things will done. Government has, they are just avoiding the situation. If you see, we are not talking about priorities. We talk about, you are just avoiding this responsibility. You have a responsibility of 250 million children over your head, out of which 193 million people are in primary section. Primary students are in primary section, and out of that, 143 of us million people, children in India, are in rural areas. So if we don't start the conversation of reopening school, we are going to go in a devastating situation. And in the end, you talk about losing, there is life and that, but we will not have a life after pandemic. It will take our country and our students to get just 10 years more to do things, and I don't think we have that much time. Like, we talk about resources being built, but even before the COVID-19 pandemic, this COVID-19 is not going anywhere. You need to adjust to this, and you need to do all your operations as a country with keeping this mind. This is not going anywhere. So will you keep schools shut for every year? Every year we'll be keep losing according lessons. You need to find ways to bridge the gap. Blended learning can be an option. There are a lot of ways that needs to come in, but you cannot sideline education, right? It is one of the most important aspects of a country and a nation. So I really emphasize on reopening schools.
Raghavendra, that was, I think the most passionate and informative plea that I've heard. And I think you made a very valid point that health is very important, and we have to take preventive measures and safeguard. But the fact that this question of reopening schools and sending kids back to school has just not been on the agenda. And why is that? Mr. Gupta, Raghavendra also said a very important thing, and he said, what kind of life are we talking about? Because if we continue like this, what is the quality of life many, many students will have?
Yeah, great speech there, Raghavendra. I mean, I really like how you spoke about need to open the schools, and much as I agree with you, just want to bring a little bit of a contrarian view here. And again, I'm doing that in my personal capacity. I'm going to speak particularly for those 143 million that you were talking about who are in rural areas, or even a little more than that in, say, public schools, right? Government schools. One of the things that Deepika ma'am suggested was that we have to follow COVID appropriate behavior there. Now, the situation could be very, very different in private schools in terms of how you are able to enforce the COVID appropriate behavior versus in the government schools. So that really, makes me a little worried. And then if you talk about the vaccination, there is a very small number of people who have been vaccinated fully, right? First dose plus second dose plus 15 days to let the antibodies build. And sometimes what, I saw this in Gurgaon where I live, that, the day the, malls were allowed to open, the mall owners came out and said that our staff has been vaccinated. So it's all safe. And I was like, oh, so you got the first dose yesterday and you think that it's safe for everyone to come to your malls today? That's not how it works, right? And that worries me particularly in case of teachers as well. In Delhi government schools, I know that more than 500 teachers have died so far. And most of them were not on, unfortunately, no, I should say fortunately, most of the teachers were not in schools, but were just managing the COVID related activities, vaccinations or registrations or whatever it was in the schools. And even then, with lower exposure, there were 500 who passed away. I dread thinking about what would have happened if schools were open that time. That said, in UNICEF, I think we've been thinking very, very hard on this point, and completely bow to the medical expertise on this. If medical experts say it is very low risk, it's equal risk, there is no real difference between the infection risk in school and outside school, then we ought to listen to that. And I would go against my instinct to listen very, very strongly to what Dr. Balsekar is saying, Shaheen is saying, Deepika is saying. So definitely data is welcome, and I think the government policy should definitely be based on that. That said, I want to say just a couple things. One is, again, in the interest of just sharing a couple experiences in the private school side, some of the kids actually liked online classes. And these were the, I think, and this might be a smaller minority. I don't like to categorize kids as introverted versus extroverted kids. But if there was such a category, then the former category actually liked being in this space. They felt more, they could express more. And we probably just need to think about that aspect as well. But all in all, I agree that, opening of the school is critical. Second point I want to make is that while the government decides, while the medical experts decide about opening the schools or not, I think there is some conversation that we could have in terms of what is our plan B. If schools do not open, how do we impart education to this large 193 million population of our young people? If you already know that our learning outcomes in the government schools, particularly in the rural areas, have been very low. Now, and imparting academic education through remote means is not that easy, as Deepika ma'am would know. It's not easy to hold the attention, etc. But could we do something different? Could we use this opportunity that we've got to do a very immersive, hands-on life skills kind of a learning? A lot of kids have dealt with adversity in this. Can we teach them how to deal with adversity? Can we make them a little more resilient? Can we teach them some critical skills like confidence, collaboration, and all those could be done in a very easy and fun way while we make this decision. So in UNICEF, this is what we are working on while we continue to work with the government on opening the schools and pushing for it to do it in a safe manner, particularly in the public school system. But we are also looking at launching something in next 1 month that would keep the young people engaged in some ways. What we heard from our interviews was that most of the young people said, in the absence of instruction, we are either sleeping or we are watching TV. And there is no real instruction to do whatever we want to on what we should do. A lot of kids said that they haven't got the books for class 10th, 9th, 11th, 12th, so they don't have and I'm talking about, again, private government schools. So in the absence of books, how are they going to be even referring to the learning materials? So we're thinking about low tech, go just WhatsApp bot-based things. 400 million young people, not young people, families have some WhatsApp connectivity. There is a digital divide. There is no denying that, but there is also a rural and urban divide. Some low tech connectivity really helps reach the farthest parts of the country and engage them in some meaningful learning journeys. So I'm happy to talk to some of you in case you would want to about what could these alternative pedagogies be.
Right. No, Mr. Gupta, what you said was interesting when you spoke about malls and all of that. And I think that's the big point. When you are reopening, when you are unlocking, when you're opening up malls and you're opening up gyms and you're opening up supermarkets, what is stopping us from reopening schools? Because quite frankly, there are similar circumstances in these areas where you talk about, let's say mass gatherings or lots of people together. So why is that? But Shaheen, coming to you, Mr. Gupta spoke about a plan B. Is there a plan B? Can there be a plan B in a country like India where not only is there a massive rural and urban divide, there's a massive digital divide?
Yeah, it's so interesting, and I'll share Teach for India has, I believe, some of the most dedicated, passionate teachers. They have gone on overdrive over the last 15 months to keep learning going for their kids. They've raised hardware where there's been no hardware. They've made individual phone calls. They've upskilled themselves. And still on aggregate, I will say, as someone from Teach for India, it has not worked, right? It has not worked to bridge learning. So while I completely agree, and we are focusing on making that better and keeping our kids learning, we must understand that it is a very poor substitute for a real education, right? So I agree, but I also think our bigger focus needs to be on getting real learning back to our kids. The second point I want to make is, I was reflecting today on, like, who is the we? Like, why is this so complex in India? And it's because the we is no one identity or person, right? Like the we is a Raghavendra sitting in his village, having migrated twice because of the pandemic. The we is also the 60% of kids who don't have access to online, right? 60% of our children have had zero learning, and studies are saying that is equivalent to 2 to 3 years of learning that they have lost. The we is also the high income kid who has full access, but is just fully checked out, is losing the hope of learning. And the we is also the child listening to this panel saying, why the hell is India not more concerned about education, right? Like, why are we not talking about this? So I think we need to just understand that this is really complex and help each other. That is my real request. We need to get on the same side of the table and say, there is fear that all of us have. And Shalini, deep condolences for your loss. And as you were speaking, I mean, I lived through the Delhi thing in a different way through loved ones, and no one ever wants to wish that on anybody ever. And I think that what we have gone through and the grief and the trauma has caused very palpable, real fear. But I think that the other side of the truth is that the damage we're doing to our kids long term is invisible, but it's real. And I think that's the conversation we need to start having, where in averting an immediate crisis, we are creating a generational crisis for most of our children across our country. And I think the real work is to be looking at all of that information together and just to start the work of preparing. And I think if we prepare, then we'll be able to answer these questions. Can our schools do it? Like, can our teachers be trained? Can we overcome parental fear? Because ultimately parents will decide whether to send kids back to school. But let's not argue about the need to start preparing. Let's start doing that work and take it one step at a time. I think the worst thing to do is to say, tomorrow, let's reopen schools. I hope none of us on this panel are advocating for that. But do we need to get schools reopened, and do we need to take the many steps needed, vaccination included, to get there? I think so.
Right. And on that question of vaccination, Dr. Balsekar, when is, and I know it's a government question, you're not part of the government, but when can we expect a vaccine for children? There's been so much talk. Bharat Biotech is testing. There was talk of Pfizer coming in, and presumably that will help and that will allay fears. But when will that vaccine come, and then can it then be delivered, in sort of good time, so to speak?
So as we know that Pfizer has approved the vaccine over the age of 12 years. Moderna within a few weeks is going to be approved. There are studies which are going on between the age of 2 and 12 with Pfizer. The results are expected sometime in October. So by the end of the year, it is expected that in countries like USA and some European countries where Pfizer is freely available, they'll start vaccinating children between the ages of 2 and 12. Our own Covaxin and Covishield have also done studies, and it's possible that the results will come by end of the year, and by next year it will probably be available for children. But the point to appreciate here is that 90% of infections in children come from adults. It doesn't come from children. Therefore, the utmost priority is that we have to vaccinate adults first. And I think we made a mess of vaccinating in India, where we opened up for the 18 to 45 before the older people were vaccinated. So if the children are brought into the picture, it's going to complicate the process even more. I think to reiterate, the adults have to be vaccinated first. They are responsible for giving infection to the children. But yes, children have to be vaccinated for the ultimate opening of schools. Now, the end point is that once 70% of the adult population is vaccinated, and that's the dream we should all have, like USA and England and now Singapore. Once you reach 70-75% of an adult vaccination program, then things ease up much more. And then it is much easier to open schools and the infection rates go down and everything comes under control. So the vaccination is very important, but for adults first. I'd just like to add one point about Shalini's talk, and I go to 3 hospitals and I understand and see what you said. And the statistics which I talked about are only to reassure parents that when schools do open, the risk is very low. It's not to say that we have to open schools now. And to reassure Abhishek and others, schools will be opened on the basis of strict guidelines. And these guidelines are known to the government. There are strict criteria. And it's only when the prevalence rate comes to a reasonable level will schools open. And when schools open with those criteria fulfilled, the risk to children is going to be extremely low. So nobody is saying we have to open the schools now when things are raging, but we have to start preparing now. And the message that we have to give, that parents should understand that when the community level of infection is low, if you open schools, then children are going to be all right. So this is the message that we need to give.
Right. But, also on the topic of messaging, Dr. Balsekar, every day you hear a new report. There is long COVID, it affects your gray matter. It sort of leaves you with lingering, there is constantly reports every day where even if it's not fatal or you're not hospitalized, there are effects that you feel for months to come. So I think somewhere there is that protective parent instinct that comes in and says, why should I even allow my children to get it? So how do we get that messaging right?
COVID is a terrible infection. There's no question about it. We are still learning. And this long COVID, which we thought was only in adults, is being seen in children as well. It's also seen not only in adults, but also in children who seem to have got away with very mild infections. So this is an infection which has to be treated with the utmost respect. But the point which Shaheen and others are making is this, that when the prevalence of infection is low, and when you open schools, we have to realize that, for example, in 1 year, the number of children who have died during the major epidemics, I'm not talking when things are better, we are going to open schools when things are better, was 0.17 per 100,000 children. So it's an extremely low number. And this was during the 2 massive waves. So when we open, once vaccination goes up, when the immunity level is built up, and when it's much safer, then I think this fear has to go down. Because we have to realize that if 1 in 6 lakh children die of COVID during the bad time, during the good times, that number will be even much, much lower. And if 1 in 7 lakh children is going to die, even by keeping schools closed, it's happening because adults are getting infected. And if one death is prevented, you must remember that maybe 5,99,000 children are suffering from lack of education. So it's a very difficult balance. We have to look at everything. And that is why it's important that doctors, politicians, administrators, educationists, parents, everybody has to come together and take a decision. To open schools is important, but to do it at the right time, in the right way, with the right reassuring messages to parents, only then are we going to move forward.
Right. Shalini, will you feel comfortable if children are vaccinated? If everyone is vaccinated, would you feel comfortable sending your daughter to school?
I think definitely, if we are looking at vaccinations going up, and like everybody has said here, even Shaheen and Doctor just mentioned that we're not looking at immediate reopening. We're looking at a phased reopening. We need to prep for that. and we're looking at vaccinations going up. We're looking at maybe vaccinations coming for children. One is not even sure, what are the long-term effects of the vaccinations on children as yet. There's a big debate even in countries like the US and Europe. My son studies in the US and he got the Moderna vaccine. And just last week, there was some news of, Moderna and Pfizer causing some blood clots in the age group of, 15 to 20 or something. So that again alarmed me. So every day there's something new. But I am definitely in for, nobody wants to see their child cooped up at home and not learning and not, for me, it's more, even more, I know I've been a teacher, I've been a special educator earlier for a great part of my life. And I know what a school does for you developmentally and socially. So obviously I'm also in for it as other parents are. It's just the safety of our children. It's just this whole thing, which is so new, which seems like a monster, and that is what we are kind of battling with just now. It's just that, yes, if we are looking at a phased opening, if we are looking at the state being more prepared, of course, a parent will be happy to send their children to school.
Deepika, you have been obviously dealing with a lot of parents, students who want to come back. But there's also been a lot of talk about, Raghavendra spoke about that there's been really little or no learning in the past 1 year. And there is a question from the audience where a lot of people are suggesting that why shouldn't it be a zero academic year?
Well, it shouldn't be a 0 year at all, because maybe there's not been 100% learning, but there's been some learning. What happened last year was most of the school, of course, India is not totally equipped, but then, yes, a lot of schools went digital. Then a lot of our trainers learned to do it digitally. Blended form is the new normal. So even when things go normal, post-COVID era, we're going to continue with this blended form. Okay. And so it's been good that way. Now, again, coming back to the learning part, yes, the learning percentage has been less. The assessment credibility is questionable. But, well, that's the reason I think CBSE could not hold the class 12th exams, But then, yes, some learning has been there. I don't agree that there's been very little learning. Let's talk about senior students for a moment, CBSE system is more or less directed towards senior school. Now with NEP, we're moving towards learning more at the primary level, having it more being experiential, activity based or skill based, like Abhishek was saying. We're moving towards it, but then I don't agree that there has been no learning and it's been a 0 year. Yes, there has been, I mean, the few things are questionable, I agree. The students are not taking it the way they should, but then I think this year should be the time when they actually feel that enough is enough, and if this carries on for another year or so, they need to take in and study at some level this blended form. And whenever, like I say, I'm all for reopening of the schools, and whenever we can, whenever the situation is good, whenever everybody is prepped up, whenever the vaccination happens, or at least for the adults, we could reopen and sort of start catering to the minds which is needed. Because yes, there's been a huge gap. There has been a gap in learning, but it's not absolutely zero. There have been, I mean, let's say at least for senior kids who like in Delhi up here, we have 11th and 12th in school, but Maharashtra and other places, they have a college or a pre-college, pre-university thing. Well, they need to learn at their own level too. And study is not about just the teacher giving a lecture. It's about more about getting down to reading and studying on your own. Of course, again, the percentage is not as large, and the teachers are not replaceable. In-person learning is not replaceable. You could have all the apps in the world, but it doesn't happen that way. But yes, we shouldn't consider this as 0 year. There has been learning. What we need to do is revisit, review our content of curriculum. Have assessments based on projects, case studies. Let them apply on their own, instead of just having the regular, pen paper test. That's not important. What's important, if it's learning, well, then you got to assess them on a different way, teach them in a different mode. And skill-based learning, of course, is in. And for that, we need to train our trainers itself. That's a big thing. It's not going to happen like overnight. So yes, the intentions are there, the willingness to change is there, the need of the hour is there. Okay. But I think, yes, there's been learning, there's a gap in it, but then it cannot be a 0 year.
Right. So folks, we've hit 6:55. We have to wrap up in the next 5 minutes. I'm going to go around the panel and take quick closing comments. Raghavendra, why don't we start with you quickly?
I do agree, with the amount of risk associated with everything. But what I fairly feel uncomfortable about is the way we are deciding, saying our children are not responsible, not, I'm not directing this, but this is what it feels like from what everybody said. Can you guys hear me?
Yes, we can.
Of course.
Yeah. So it is also should be the choice in our hands. I don't think that students can be responsible. We can be responsible. We know we are accountable to our own learning, and sadly we have showed really in the pandemic, like the way students have been learning YouTube channels. If you see, there's a lot of things that are happening run by students. So as this problem approaches of the school, we really need to think our students and educators as partners. This is something that is very urgent and emergent, but behind those 280 million number, that is not a number. Those are human beings, and they have a choice also associated with them, and that should also be considered when we talk about reopening any as such. They have their own plights and their own, you understand the fear and everything, but we as students, we also have feelings and we have choices that we also control, and dislikes and likes everyone does. So this should be considered as a movement together, not something just decided by policymakers and alone, like always it has been.
No, absolutely. I think it's crucial that we listen to our children. Mr. Gupta?
Yeah, I think I completely agree with the panelists in general, Raghavendra particularly, that we need to involve young people into these decisions and take their inputs before we go to policymakers. I would say that completely agree that there has to be a preparation there. We have to prepare. Let's hope that 70% of the adult population and young population also gets vaccinated, say in 3 to 6 months time, and that's when probably the schools will start opening, hopefully. And in that period, I just say that let's have some action bias and do what we can in that.
Right, Shalini?
Yeah, sure. So after listening to Raghavendra and everything, it's not directed actually to any child like that per se, and you're not. It's not as if you're not. You can't take your own decisions. Definitely, we have to keep the children in mind and what they want. At the same time, I think the policymakers and the parents together as a group, we need to kind of work towards, phased opening and safe opening for the children. I'm all for that.
Right. Deepika?
So, I mean, again, Raghavendra, 3 cheers to you. After listening to him, I'm so hopeful, reinstates my confidence in the entire lot. And like I said, not everybody did not learn anything. It was not like that at all. So no 0 year. And I'm pretty hopeful that things would be fine. And of course, we would need to work harder whenever the schools reopen. Okay. But I'm sure things would be fine. And like I said, I'm really hopeful and happy after listening to Raghavendra.
Dr. Balsekar?
I think discussing when and how to open schools is a priority and should not be an afterthought. Little has been discussed so far. I think we should pass on the message that it's safe. And every parent says that I don't want to take a chance and I'd rather not send the child to school. But we must remember that when we do it in the right way, if you don't do it, you're taking a chance, because you're really harming the child by not sending to school also.
Right, Shaheen, last words to you.
Yeah, I mean, very similar. I think let's think about our child's present and let's also think about their future. And for that, it means we need to think about health and we need to think about education and learning. And the second quick point is let's make sure that this conversation is not just about our child at home, but it's about all children in the country, really understanding that equity plays so much into this. And lastly, and I think the point Raghav was trying to make, and I want to re-emphasize it, we do not give power to our children in this country. We do not give them voice. They are powerless. And we need to change that. We need to trust that we have 250 million school children that can help us through this. And can really help us more than this to even reimagine education fundamentally.
Absolutely. Thank you all so much. I hope this conversation moves forward, that some of these voices, these thoughts reach the policymakers who are taking these decisions, and not now, not tomorrow, not perhaps the day after, but whenever it is safe, in a few months, we do see schools reopening in India. Thank you all so much for this conversation.